Hello everyone, this is Dr. Aakash Agrawal. I'm a consultant in neurology in Amri Hospital, Bhubaneswar. So today on the occasion of National Epilepsy Day, going to learn a few points on epilepsy for common people, how what does epilepsy mean and how to go about managing it. So epilepsy is usually long conditions wherein patient needs to take medicine regularly from time to time. And nowadays, as because there are lots and lots of medicines available which are safe and very effective, so medicines, a wide variety of medicines are available which suits each particular patient's needs. Epilepsy can be very threatening in the sense because the patient is not aware of what's happening around himself or herself. Patient might injure himself when the patient is having a seizure. Epilepsy is a collection of seizures, or you can say it's a lifelong condition almost, where the patient has recurrent seizures. So during this process, if the patient is usually driving a vehicle or is very close to a fireplace or is swimming or is at a very in a building, top of a building, so these can be pretty dangerous situations where we need to be careful. So that's the reason we ask the patient to be away from these situations, and if they are to be there, they have to be under a constant monitoring. Okay, so that's the number one point. Number two is the patient should be taking medicines whatever has been prescribed to him regularly from time to time. This is very important because keeping a dose of medicines or delaying the dose of medicines can be very harmful and can precipitate a episode of seizure. The patient should always try to keep a diary, events, day-to-day events, especially if the events preceding a seizure, like lack of seizures, and also mentioning the time of medicines when or he or she has taken the medicine, so that it becomes effective reminder for him as well as the physician to guide him in the treatment process. And very importantly, the lifestyle things, like the patient has to maintain a very regular sleep schedule, so that uh, the sleep, which is deprivation, which is an important factor for precipitating a seizure episode. So that is very important. And another thing is alcohol. Alcohol can sometimes precipitate an episode of seizure. So staying away from alcohol is very important, especially in persons who are having a epilepsy condition called as juvenile myoclonic epilepsy. A ID card with himself stating the condition or stating epilepsy he or having, and the medicines he or she is on, so that a bystander, if he or she is having an epilepsy seizure, helps the bystander to help him reach a medical center very rapidly and help in early treatment of the seizure. Thank you.